So we are reading Water, You're Not Sick, You're Thirsty by Dr. Batman Gilich. We are on chapter 4, page number 43 of the PDF.
Crib death. Crib death or cot death or CD or sudden infant death syndrome, SIDS, is the name given to the unexplainable and unpredictable death of a child in its crib. Losing an infant during its sleep is one of the most devastating tragedies imaginable. Every year, 7,000 to 8,000 babies between a few days and a year old die inexplicably while asleep. The greatest frequency is among infants 2 to 6 months old. Diagnosis relies on exclusion of other causes and is based on autopsy examination. Vomiting up milk and then choking on it is usually not the cause of death. It is not caused by infections or colds. It is not the result of a contagious disease. The primary cause of CD is not really known. I have thought much about the possible physiological events that might cause the death of an infant during sleep. I feel that the only plausible event that might be responsible from the perspective of the paradigm shift is the constriction of bronchioles due to dehydration and heat management programs of the body. When the infant is possibly bundled too much and the room is warmer than it should be.
Now, this is very important, right? So now what happens? When a child is born, we bundle the child up and we keep the room warm. Okay. Now that can create a problem because there is too much of water lost. There can be dehydration because of the water lost. Okay. Now, when too much of water is getting lost, the body is going into drought management. So it is going to control the bronchial. So it is going to control the breathing. The same thing happens when a patient is asthmatic. Okay. So this is something very important that we should really look at.
I would call it infantile asthma. If childhood asthma can kill a few thousand annually, even when treatment is available, why should asthma not be considered as a primary cause of death in infants who have no means of expression when in deep sleep? The formula milk the infants drink may also contribute to CD. There is a marked difference between human milk and cow's milk.
Okay, so cow's milk contains certain hormones which are not human. Okay, so naturally it can create a issue. It can create a problem for the infant's digestive system.
Cow's milk is designed for the needs of a calf that stands and begins to move and runs around in the first hour of life.
No.
The newborn child is immobile for the first several months of life. Herein lies the reason for the difference between the natural consistency and design of human milk and those of cow's milk. When cow's milk is formulated and given to infants as their only source of water, only parents are told not to give infants water. The metabolic system of the infant is burdened by digestion of the concentrated milk. Concentrated milk can have detrimental effects.
So what does this imply, right? That today the cow's milk actually has more fats and proteins than human milk. So because of that, what happens is that the digestive system of the child is put under pressure to digest that excessive fat and protein, which is not there in human milk. So naturally, the milk, when you're mixing the milk and giving it also, there is less water content in the milk also. So mother's milk is the best milk for a child because it contains a balance of whatever the child needs. If you're giving supplementary milk, then you need to be clear about the hydration, right? Because to digest that excessive fat and protein, again, water is required.
I was told at a medical conference that autopsies of infants who had died in car accidents showed an obvious partial blockage of the coronary arteries of those on formula milk. and not of those who were breastfed.
So what this implies is that naturally the formula milk is causing the arteries to get blocked.
This is a significant revelation that has not been dealt with publicly and openly. I am of the opinion that the coronary arteries of infants on formula get blocked because the formulated milk composition is more concentrated than the mother's milk.
So what this would imply is that we should dilute the formula milk more than what we are normally doing.
The normal practice is that the infant is given concentrated milk and bundled to sleep. While asleep, much water, in comparison to the weight of the infant, is lost from the lungs during the exhalation phase of the breathing process. This water loss from the lungs, on top of the fact that the milk contained possibly only just enough water for the digestion of the milk itself, leaves the infant's body short of water and forces it into physiological events for drought management.
So again, because the water is less, the body goes into drought management, and then it starts to suck water out from the systems which are not considered very important by the body system. And the infant's body system wants to live. So it'll send water to the brain. So now naturally, if the water is not available, it can constrict the breathing, which can cause the suffocation of the baby.
These include the secretion of increased amounts of histamine, which in infants is also a growth hormone and is abundantly available. Histamine is also a constrictor of bronchioles. It is possible that a certain combination of milk intake, unfavorable environmental conditions, and the inability to cool down could tip the balance towards the constriction of the bronchioles in the infant and cause silent death in sleep.
So maybe it's not such a good idea to totally bundle up the baby, so that at least certain breathing spaces available.
What surprises me is how the body of an infant is so resilient and adaptive that this problem is not seen more frequently. I can only think that the digestive process in the infant is so strongly active that the metabolic process manufactures some water from the breakdown of the solids in the milk to help the process in the same cycle of milk intake. If this is the case, what tips the balance against the infant and causes CD to occur are unfavorable environmental factors of too much heat and excessive covering of the body.
So that's it, right? To not bundle up the babies too much.
I think we should go back to the practice of introducing water into the diet of infants, particularly in the 2nd to 6th months of life, when the occurrence of crib death is most frequent. They should not get too much of it, but a balanced amount and always with or after milk. This practice might cultivate a taste for water from infancy and establish a stronger thirst sensation and prevent overeating when people really are only thirsty later in life.
So again, water becomes very important.
Water regulation during childhood and adolescence. When a child is born, its water needs for healthy growth and development are supplied initially by water in the milk it drinks, and then by water intake itself. The growth hormone and other water regulators drive the thirst mechanism and the body's call for water. At the same time, the body retains water at any cost. The kidneys begin to concentrate the urine and draw as much water as possible away from the final stages of urine formation. The driving forces behind water regulation for growth are the growth hormone and other associated hormones and neurotransmitters such as histamine.
So again, whenever there are water related issues, histamine comes in. And it is, again, I'm repeating what I've said yesterday and before, that today antihistamine tablets are given because of the misconception that histamine is causing the problem. But it is not actually histamine causing the problem. It is a dehydration which is causing the problem, which causes the body to produce histamine to regulate the loss of water.
Because they are growing, children are constantly and naturally dehydrated. The process of cell expansion and division uses up a great deal of water. 75% of each cell is water. The body of a growing child constantly needs and calls for water, otherwise, growth would not be possible. If the natural calls of the body for water are satisfied by manufactured chemical containing fluids and sugar containing drinks, healthy growth and development, events that water itself initiates, may not take place efficiently, and crisis events such as asthma and allergies may occur.
So again, we have to have water for water. You cannot replace water by other aerated drinks and other drinks, right? So suppose you're having a juice. Juice is considered a food. It is not a liquid, right? As far as the body is concerned, because the body needs to digest the food. That means it needs to digest the juice. It doesn't need to digest the water. Water can be absorbed directly.
Children and young adults should learn to drink water by itself and not substitute other beverages. The brain's alertness and learning capacity are proportionately dependent on the water intake of the individual. When teenagers, who should be alert and full of life, put their heads on the desk and fall asleep in class with a soda can next to them, it could be a sign that their bodies are short of water. Brain functions improve when water intake is increased to fully hydrate the body at all times.
So again, the brain needs water. It needs to be hydrated. If enough water is not there, brain fog occurs. Okay. And numbing of the brain can start happening.
I once had the occasion to lecture to 3 science classes at a local high school. I checked the urine bowls in the toilet for the color of the morning urine passed by the male students. All the bowls contained very dark, obviously concentrated urine, an indication of severe dehydration. Parents should become aware of the volume of water their children drink. It is their responsibility to educate their children about the importance of water and to discourage addiction to manufactured colored drinks. This is not the statement of a Puritan. It is based on an understanding of science.
So again, if the color of the urine that you're passing is dark, that means you're not drinking enough water. Very straight and simple.
Water management in adults. After full physical growth has taken
Shimala, we can't
place,
hear you.
After full physical growth has taken place and the body is no longer in its growing phase of physical development, the effect of the growth hormone is no longer a dominant factor in the regulation of the body's water intake. At this stage of life, the body's water regulation becomes the primary responsibility of nerve centers in the brain that employ histamine as the chemical messenger.
So again, histamine is the most important chemical as far as water regulation is concerned in the body.
It is at this phase of life that the thirst sensations become insufficient to regulate for adequate water intake. The reason for this failing thirst sensation seems to be very delicate but simple. Our bodies, although many millions of years down the road of development from the earlier species that stepped out of water and ventured onto land, still depend on the same adaptive processes that were developed by their water-dwelling progenitors. They formed strong water management systems to enable them to stay out of water for longer and longer periods. Although the body does not possess any means of retaining excess and spare water in the same way that fat is stored, it still has to be able to cope with periods of drought.
Right. So again, the thirst sensation is very, very important, right? But it is not sufficient to regulate the water intake. So proper water management systems in the body need to be developed. We need to be consciously aware as to how much water we are actually drinking.
The physiology of the body is always dependent on water. Management of drought does not mean that the body cells become independent of water. It only means that certain areas of the body that are less in demand and not used all the time will be given survival rations only.
So again, so you've gone into survival mode, right? So if you don't hydrate properly, then certain systems in the body will start to shut down over a period of time.
The entry of water into these cells will not be by free flow, but will be coupled to the need to act commands to the cell. Water intake is regulated by a decreased flow of circulation to the inactive area.
So again, so what happens, right? If an area of the body is being shut down, then the blood circulation also in that place will slow down. So naturally, it will create problems in that area of the body.
Then, if the area is forced into activity, the vascular circulatory system opens up and water is brought to the region.
So again, if that system is needed, then water is provided.
From the age of about 18 to 25, when the body has reached full height and breadth, our regulation of water intake depends on the thirst sensation and our attempts at satisfying this sensation. Unfortunately, our thirst sensation, as it is understood today, a dry mouth, is not an accurate indicator of the body's actual water needs. If we don't feel thirsty, we tend not to drink water. We wait to become thirsty before we even begin to think of drinking water. The whole problem of health deterioration begins by this very attitude towards water intake. Deficit management only, and even that is only if in half measures.
So again, if you start feeling thirsty, that means again you are getting dehydrated, right? But the body needs water before even you get a dry mouth. So you have to start becoming aware of it. There is no other way to actually manage this process.
By the time the body reflects its thirst through invoking its thirst sensation, it is short of 2 to 3 glasses of water. We may drink only 1 glass, leaving the body with 2 glasses less than it needs. Unfortunately, this gap expands as we grow older.
So this may be one of the reasons why you'll see that older people, they tend to shrivel up. Okay. They tend to shrivel up. The skin starts to get wavy. It starts, like you can pull the skin and all that stuff. Why? Because there is a water deficiency in the body system.
Reduction of thirst sensation. The body has an ability to adapt to some hardship. Low food intake and temporary shortage of water in the body seem to invoke an adaptive process. The essential functions of the body are managed until we have access to food and water. In this process, the sensation of thirst can be confused with the feeling of hunger because both sensations are similar in the way they register. They stem from low energy levels in the brain. This is one of the main contributing factors in the development of obesity in the young and the old. They mistakenly eat food to satisfy their thirst sensation.
So again, we come to the topic of the book or the title. You are not sick, you are thirsty, right? You are not hungry, you are thirsty. So we mistake the sensation of thirst for a craving for food. And as I mentioned before, since you're not giving the body water, the body thinks, okay, you might as well if I can get food, I can extract some water out of the food. So you get a hunger pang in once you do not respond to a thirst pang.
They seem to respond to both calls, thirst and hunger, as if they are only hungry. They begin to eat until the thirst sensation gathers greater strength as a result of the additional load of solid food within the system. And only then do they drink some water.
So again, when you eat food, it needs water to digest it, right? It needs water to even extract the water from the food. That's when the thirst sensation again pops up.
This type of thirst satisfaction is not enough for the urgent needs of the body, but is just enough to fall inside the body's limit of temporary adaptation to water shortage.
So basically, we are doing crisis management. We are not really taking care of the issue.
In this way, the water shortage in the body becomes a steadily expanding chronic state, and new thresholds of adaptation are forced on the body. This process results in a slowly deteriorating loss of thirst sensation, so much so that the need for regular water intake as a sensation gradually becomes forgotten.
So now if your body is giving you a signal and you're not responding, again it's giving a signal, again you're not responding, the body decides that this guy is not going to listen, forget it. It's like any other person, right? If the person is not responding to what you're attempting to tell the person, after some time you'll say, forget it, this guy is not going to listen. So the same thing happens in the body.
Histamine can act as a temporary substitute for water by releasing energy for some extremely sensitive body functions. In this way, the body can survive some dehydration. It seems the body begins to rely on the emergency functions of histamine and allows dehydration to continue.
So it's like using the stopgap arrangement as the main arrangement, right? And then that naturally creates problems.
Still, no matter how useful the possession of these emergency powers, dehydration is damaging to some less used functions of the body. Gradually establishing chronic dehydration produces constant changes, initially in the physiology and eventually in the chemistry of the body. The body begins to survive on the constant verge of failure.
So if the body is on a constant verge of failure, it is operating in a stressed out situation. And when it's operating in a stressed out situation, then naturally many of the bodily functions are not working properly. Also, the sympathetic nervous system gets activated and the repair and maintenance systems of the body, which work with the parasympathetic nervous system active, start to shut down.
The histamine-operated centers of the brain seem to recognize the levels of water that enter the body. If sufficient water enters the body, the active histamine centers gradually become disengaged from their full-time responsibility as water regulators. The engagement of histamine in drought management and its substitution for some energy transforming functions of water decrease and are eventually phased out. It seems that the body begins to realize that there is no water shortage and becomes more alert to and conscious of its call for water. It begins to understand and manifest thirst.
So again, it's a matter of habit, right? The more you do something, the more used to you become to that. So if you go into drought management all the time, you're working with thirst, then that is what will happen. But if you're giving adequate water, then the body says, okay, if I signal for water, I'll get water. So So it starts to signal for water by the thirst process.
It seems to me that the loss of the thirst sensation is an adaptive process to false information that water is not available because we don't drink it.
So again, it's adaptive, right? So we need to put the correct process in position.
If the body is once again conditioned to regular and adequate water intake, however, the thirst sensation becomes sharp and the urge to drink water becomes strong. The body begins to indicate water shortage more forcefully. The rehydration of the cells takes place slowly. The cells of the body are just like sponges, they get soaked slowly. Do not imagine the body will become optimally hydrated after just the first glass or two of water. The water that is taken will not immediately enter all the cells. Upon regular and adequate intake of water, the process of full hydration of the cells will take a few days. Only when you realize what damage dehydration can cause will you take seriously the need for strict adherence to hydrating the body regularly and well. The quantity and timing of water intake is very important and will be discussed in a later chapter.
So again, it slow absorption will be there in the body, right? So when you start drinking more water, you may first start to urinate more, right? And then slowly the body will start to absorb the water.
Everyone knows water is
Can't hear you, Shivam.
Everyone knows water is essential. What is not fully realized is what happens when the body is not provided with adequate water on a regular basis. Also, what is meant by the body begins to survive on the constant verge of failure.
So it's again absolutely, on the edge, on the cliff. It's about to go down, but it's managing to hold itself, which is not a nice way to actually live.
The human body is a composite structure made of many different systems. All these systems are dependent on the various properties of water for their normal function. When there is not enough water in the body for all the functions to take place, something has to give. When the body is only just managing to cope with daily routine activities, and then a sudden emergency situation arises and an action has to take place, how will the body show its limitations? Suppose the body is in equilibrium within a threshold, and all of a sudden, new obligations are thrust on it until the threshold is passed. How will the body show its shortfalls? In short, how will the body cope with the sudden stress of having to cope with emergency situations that demand water dependent responses when the body is already dehydrated? In a sense, the answer to this question is the main topic of this book.
So if you're not hydrated properly, energy levels will be low and your ability to respond to situations will automatically get compromised.
The damage of dehydration is established when the proteins and enzymes of the body become gradually but increasingly inefficient. The individual cells in the zone of dehydration begin to function less efficiently until eventually the loss of cell function becomes permanent.
So again, this is important, right? So as the system shut down, if hydration is not provided, the system will totally shut down. So then it cannot be revived.
In any state of free water loss from the body, 66% is lost from the cell content, 26% is lost from the fluid between the cells, and only 8% is lost from the blood volume.
So naturally, again, this is something that came up before also, that most water loss takes place from within the cell and then the fascia and then from the blood. The blood is the last to release the water because Blood also needs the water to transport the oxygen and other nutrients to various parts of the body system.
This causes concern in light of research by Bruce and associates. They have shown that as we grow older, from the ages of 20 to 70, the water content inside the cells becomes less than the amount of water outside the cells of the body. The water inside the cells is gradually lost until the osmotic balance is reversed. This reversal of balance makes it gradually more difficult for our cells to absorb and hold water as we get older. The question we need to ask ourselves is, what happens to our bodies when they are allowed to undergo such a drastic transformation of their cell water content and composition? Read on for the answer.
So again, all sorts of things will start to happen.
Chapter 5. What is chronic dehydration? Imagine a juicy plum picked from the tree and left exposed to the sun or wind. It becomes a prune. The dehydration of the plum produces the shriveled interior and wrinkled skin that are typical of a dying fruit. Loss of water causes the internal and external structures of living things to change, be that dehydration in a fruit or in a person.
So basically, dry fruits are dead fruits, technically, according to this, because they've got shriveled up.
There are up to 100 trillion cells in the body of a human being. Depending on the area where the dehydration has settled most, the cells in that region begin to wrinkle, and their inner functions are affected. A shortage of water in any region is reflected by different signals that denote dehydration and are the body's indicators of its local or general thirst. At present, these indicators of dehydration of the body, some of which I listed in a previous chapter, are not understood and are treated as indicators of disease conditions of unknown origin.
So again, stuff which is caused by dehydration, they are labeling it as we don't know why is it happening.
Identifying dehydration. What are the most common indicators of dehydration? What happens to our bodies when we don't drink enough water? What is enough water? We now need to find the answer to these three important questions. A must-do before we begin. You need to turn on your brain's logic powers and put aside any preconceived ideas you might have. Whatever you have read about health matters in the past probably did not reflect the true importance of water to health and well-being. From my perspective, there are three different sets of sensations that signal local or general thirst. At most of these stages, the presenting symptoms are reversible without much damage. Number 1, the general perceptive feelings. They include feeling tired, feeling flushed, feeling irritable, feeling anxious, feeling dejected, feeling depressed, not sleeping well, feeling heavy-headed, having irresistible cravings, and having a fear of crowds and leaving the house. Some of these will be discussed in the next chapter. Number 2, the drought management programs. The second group of conditions that represent indicators of dehydration are the body's drought and resource management programs. There are 5 distinct conditions that denote states of dehydration and operative rationing processes that can be corrected easily. The sixth in this group consists of a number of conditions that have been classified as autoimmune diseases, which should be looked at as a sort of cannibalistic process of resource management at the expense of the body's own tissues brought about by persistent dehydration. The conditions are 1. Asthma, 2. Allergies, 3. Hypertension. 4. Constipation. 5. Type 2 diabetes. 6. Autoimmune diseases.
So autoimmune disease, the body is literally eating itself up.
The more drastic emergency indicators of local dehydration. After much clinical and scientific research, my understanding is this. Depending on the location of acid buildup inside the cells, the following forms of pain are early indicators of potential genetic damage produced by chronic dehydration in the human body.
So again, as we dehydrate, then what happens is that the acidic environment in the body starts to build up. And then that naturally causes pain, irritations, skin rashes, and all that stuff.
Number 1, heartburn. 2, dyspeptic pain. 3, anginal pain. 4, lower back pain. 5, rheumatoid joint pains, including ankylosing spondylitis. 6, migraine headaches. 7, colitis pain. 8, fibromyalgic pains. 9, bulimia. And 10, morning sickness during pregnancy. There is a further set of conditions that represent complications, tissue transformation, and organ damage caused by persistent dehydration in the fourth dimension time. Each of these conditions will be explained thoroughly in upcoming chapters. Chapter 6. Newly recognized thirst perceptions. The following are perceptive feelings, some of which are labeled psychological disorders that I believe signal dehydration. 1. Feeling tired without a plausible reason. Water is the main source of energy formation in the body. Even the food that is supposed to be a good source of energy has no value to the body until it is hydrolyzed by water and energized in the process. Furthermore, the energy source for neurotransmission and for the operational directives that gets things done in hydroelectricity, which is formed in the nerve pathways and their connection to the muscles and joints in the body.
So again, we've read before that water generates electricity in the body system. And we are a totally electronic system, right? We generate a lot of power and energy in the body system. So naturally, if the water is not there, that starts to get affected.
2. Feeling flushed. When the body is dehydrated and the brain cannot draw sufficient water from the circulation to satisfy its need, it commands a disproportionate dilation of the blood vessels that reach it. Furthermore, the face is not a simple organ that supports 2 eyes, a mouth, a nose, and 2 ears. It is a receptor dish with an abundant supply of nerve endings that constantly monitor the environment and report their information to the brain. In other words, the face is an extension of the brain with highly sensitive functions. Its nerve endings need to be hydrated too. Hence, the increased circulation to the face at the same time as the brain gets its increased blood supply. If you see someone with a red nose and flushed face, often seen in alcoholics because alcohol truly dehydrates the brain, leading to hangover headaches, that person is dehydrated and in need of water.
So again, when you're drunk, you need to drink water. Otherwise, your face will get flushed because more supply of water is required in the face.
3. Feeling irritable and unreasonably short-tempered. Irritability is a cop-out process so as to not engage in a brain energy consuming involvement beyond that particular moment. Give irritable people a couple of glasses of water and you will see them calm down and become fairly amiable.
So again, when we are doing biofield tuning, I've come to a very funny kind of a solution. Whenever the sun star stops at the nose, I immediately tell the person that you are getting irritated. And one of the ways that we've told them to handle it is hold the nose go and have a glass of water immediately. So as soon as they're having a glass of water, they tend to cool down. So the irritability levels will calm down. So whenever someone is stressed out or shouting and screaming, and even a child is crying, we tell them to have a glass of water. This is the reason for that.
Or feeling anxious. This is a perceptive way in which the frontal part of the brain can reflect its concern over water shortage in its domain of activity. I cannot imagine a more eloquent way for the thinking brain to reflect its anxiety about dehydration in the body of its delinquent owner. Obviously, when the body wanted water, it must have been given other beverages that did not satisfy its real needs.
So again, when you're feeling anxious, drink water.
5. Feeling dejected and inadequate. The capital assets of any body are its essential amino acid reserves. These types of amino acids are used in so many different functions, including for neurotransmission, that their shortage in the body means loss of assets that the brain assesses as insufficient and inadequate for its undertakings. Dehydration depletes some of these amino acids incessantly, and this shortage triggers a feeling of dejection.
So again, water is needed to produce amino acids in the body system.
6. Feeling depressed. This heralds a more serious phase of dehydration in which the body, in the absence of water, has to use up some of its vital assets as antioxidants to cope with the toxic waste of metabolism that has not been cleared by sufficient production of urine. These assets include the amino acids tryptophan, production, pronounced tryptophan, and tyrosine, which are sacrificed in the liver as antioxidants to neutralize toxic waste.
So now what does this imply, right? The amino acids are meant to be building blocks in the body system. They are supposed to do the repair and maintenance, build more structures, right? Now, because of dehydration, they are being used to take care of the toxic waste. So they are not used in building the body up. They're used in removal of the toxicity. So naturally, the body's building block or building or repair and maintenance ability starts to get compromised.
For the manufacture of serotonin, melatonin, tryptamine, and indolamine, the brain uses tryptophan. All of these elements are vital neurotransmitters that are used to balance and integrate body functions.
So again, if these chemicals are not produced in the body, which is again produced from the amino acids, then naturally the regulating systems of the body start to get affected.
If they are inadequate in the body, depression sets in. Tyrosine is another amino acid that the brain uses to manufacture adrenaline, noradrenaline, and dopamine, which are the go-getter neurotransmitters. Their insufficient activity will ground a person into inactivity and a sorrowful state of mind.
So sorrowful state of mind means depression. So again, hydration becomes very important in combating depression.
As I was editing this book, an article on depression in the Washington Post on Tuesday, May 7th, 2002 revealed a deep-rooted deception by the pharmaceutical industry. Headlined, "Against Depression, a Sugar Pill is Hard to Beat." The article exposes how the drug industry has bent the truth in clinical trials to show an edge in favor of Prozac, Paxil, and Zoloft, whereas a simple sugar pill, placebo, produced more positive results in relieving depression.
So what is a placebo? You don't give the actual drug, you give a sugar pill, and then you see there's a control group which is given a sugar pill, and there is a monitoring group which is given the actual pill. And then they decide what is the result of both the groups, right? So over here, clearly it shows that all these drugs were ineffective compared to just a sugar pill. So there was no reason to have those pills actually. But again, the pharmaceutical industry is financing these reports. So naturally, the reports will be screened towards the benefit of the pharmaceutical company.
This article surmises that the splendid results of the sugar pill against the much touted drugs could be because in the clinical trials, the subjects received much more attention and care than a depressed person who visits the doctor for a few minutes a month. It seems there is an infinitely greater healing power within a person who is cared for. In medicine, there used to be a dictum, now forgotten. The duty of a doctor is to amuse the patient while nature heals. Doctors have to show empathy to their patients.
So there's a book by Dr. Larry Dossey on healing called Healing Words, in that he has studied the effect of prayer on healing, right? So again, if a person is cared for, then automatically the problem gets muted. So there was an experiment, I think it was in another book, it was called Conscious Universe, where there was a group of lab rats. These lab rats were given injections, cancer cells were injected into their body system. But out of these lab rats, or they were guinea pigs, one of the guinea pigs did not get the cancer. And they could not understand why that guinea pig didn't get the cancer. Ultimately, through the closed circuit television, they found, or the recordings they found, that one of the attendants in the night shift had an affinity for that particular guinea pig, and every night he used to hold the guinea pig in his hand and pet the guinea pig. So that's why that guinea pig did not get the cancer. So it says very clearly over here, greater healing powers within a person who is cared for. So if someone is cared for, automatically their immunity system starts to work better. Their repair and maintenance system starts to work better because of the fact that the patient feels someone cares for them.
Now that I am addressing the role of water in emotional problems, let me quote from a reader review of my book, Your Body's Many Cries for Water, posted on the Barnes and Noble's website. MS writes, water has made a difference in my life. It seems that MS has been diagnosed with mild manic depression and had been given lithium for 4 to 5 years. He says he started on water and salt and some vitamins according to the instructions in the book, and within 2 months he was able to stop taking his lithium.
So lithium is a sleep-inducing drug.
He had been visiting his doctors for 9 years without significant improvement and now writes, "My life has been truly enhanced from reading the book." 7. Feeling heavy-headed. This is the sign that the brain is commanding more circulation for its needs. It could be the heralding sensation for a migraine headache that may ensue if the increased blood flow to the brain does not result in adequate hydration of the brain cells. Do not forget that the brain cells, in their constant activity, produce toxic waste of metabolism, which must be cleared at all times. The brain cells cannot endure a buildup of acidic materials in their interior environment. The initial heaviness felt in the head could reflect this phase of brain physiology.
So again, if the water is not there, the brain will not function properly.
8. Disturbed sleep, particularly in the elderly. The body will not have a restful night's sleep if it is short of water. A full 8-hour sleep will further dehydrate the body because much water is lost in respiration and possible perspiration under heavy bed covers.
So again, this is something that you all can actually test. We lose about half a kilo during the night. So if you want to take your weight, you take your weight before you're going to sleep. You go to sleep in the morning, you again take your weight, you will find that it is about half a kilo less. This is happening because of loss of water.
If the body receives water and a little salt, sleep rhythm will be re-established immediately. The following letter is from a man who found my water cure program instrumental in relieving many problems, including an interrupted sleep pattern. His story highlights a number of the perceptive symptoms of dehydration I have pointed out already.
So over here, he says salt, right? So somewhere in this book or in some other books, he says that you put a little bit of salt on the tip of your tongue and then drink the water. It enhances the body's ability to absorb the water because a proper signal gets sent. The body gets prepared for absorption when that salt is put on the tip of the tongue. So that's why he's saying salt and, water, receive the water and a little salt.
My name is DH, and I was turned onto your website by a friend on the internet. Firstly, I read much of what is on your website and have been impressed by the content. In fact, I opened a chat room on Paltalk devoted to directing people to your site and discussing the benefits of drinking water with salt. I have been on the water cure for about 3 weeks now, and I can definitely say I'm feeling better. My blood pressure is lower and my heart rate is around 58. I seem to sleep better at night and I have better energy levels during the day. Also, I have a peaceful feeling now and seem to worry less. All in all, it has been a positive experience. I thank you for promoting the water cure and I have joined your bandwagon to spread the good word. Thanks again for helping others unselfishly, DH.
So again, increasing water supply with a little salt.
9. Anger and quick temper. These are more expressive ways of showing dehydration were explained in section 3 under the heading feeling irritable.
So again, drinking water will reduce irritability levels or anger levels.
Ten, unreasonable impatience. Maintaining your patience to stay on a course or an assignment is an energy-consuming undertaking for the brain. If it doesn't have a sufficient stored reserve of energy, it has to put an end to the undertaking as quickly as possible. This process of quick disengagement is labeled impatience. Don't forget, water manufactures hydroelectric energy at a rate that can replenish the used up amount. Energy from food has to go through many steps of molecular conversion until it is stored in the energy pools in the cells. Even this process needs water for hydrolysis to make the components of food usable as sources of energy.
So water is an immediate source of energy. Food needs to be digested for the energy in the food to get released. So if you're feeling low, if you're feeling impatient, you're feeling angry, immediately drink 2 glasses of water.
11. Very short attention span. This is another disengagement process for the brain that needs energy to focus on a topic or a learning process. The more hydrated the brain, the more energy it can manufacture to imprint new information in its memory banks. Attention deficit disorder in children is similarly produced by dehydration when children choose sodas as their preferred drinks.
So again, ADD, ADHD is becoming so vogue, and then children are being prescribed medication, right? So one of the ways to combat it is hydration. This is something that we always tell people when people are coming. This is for biofield tuning and other processes. Of course, in the workshop, we constantly tell people drink water, drink water. In biofield tuning, also one of the questions that I always ask people when the Earth Star, Sun Star are off, how much water are you drinking? This is a standard question that we are asking everyone. And let me tell you, most of the people are drinking less than a liter. Most of them are not even aware how much water they are drinking, right? So awareness becomes very, very important.
12. Shortness of breath in an otherwise healthy person without lung disease or infection. People who want to exercise without feeling short of breath should drink water before they exert themselves in any form of physical activity.
So the water is already stored, right? It's in the system, and the system can easily absorb it before any kind of physical activity.
13. Cravings for manufactured beverages such as coffee, tea, sodas, and alcoholic drinks. This is the way your brain tells you that you need to be hydrated. These cravings are based on a conditioned reflex that associates hydration with the intake of these beverages, which actually dehydrate the body further.
So again, all these beverages are not good for you as far as the hydration process is concerned. But we have a craving, we want a liquid, we think that that will satiate our craving, but it actually does the opposite.
The process of continuous dehydration is stressful and causes the brain to secrete stress hormones, which include endorphins, the natural opiates of the body that help it get through its environmental crisis. One of the reasons why people continue drinking these beverages is their increasing addiction to the level of their own endorphin production. This is why caffeine and alcohol are addictive substances and cause withdrawal symptoms.
Absolutely right, right. Caffeine and alcohol are, they create withdrawal symptoms simply because your body is used to the chemicals which are produced due to the stress that are caused by these drinks. So we may think that caffeine is a pick me up, but it actually stresses the body, to which makes it release opiates, right? To counter the effect of the stress, to manage the stress. And we get addicted to that. I got addicted to caffeine, and I know how problematic it was. That if I didn't have the coffee, and I had started going crazy, and then suddenly I realized that, and I had tremendous withdrawal symptoms even just from coffee. So you have to be careful as to how much coffee you're drinking. I used to drink 8 or 9 cups a day of black coffee, and it became a big problem ultimately. It was very hard to kick it.
The next stage to this kind of addiction could be the use of harder drugs that put a constant drive on endorphin secretion by the body. Thus, if children are to be directed towards a drug free form of life, it should start with eliminating caffeine from their diets.
So we should be careful about the aerated drinks that the children are drinking. We'll just finish this chapter. It's another page.
14. Dreaming of oceans, rivers, or other bodies of water is a form of subconsciously generated association to reach a source of water to quench thirst. The brain has a tendency to simulate an experience in order to give instructions to the person to perform a function even in deep sleep.
So the subconscious communicates to us through the dreams, right? So if you're dreaming water dreams, that means you need water. For example, when Robert Monroe says that when you're having dreams of flying, means that you're having an out of body experience, because the brain doesn't have any other means of understanding or creating that experience. Likewise, when the water body is dehydrated, you will dream of water.
There is usually some significance to dreams. I will never forget a dream I had when I was a house doctor working at St. Mary's Hospital Medical School in London. At the time, I was responsible for the daily care of 30 acute beds, as they
30.
were 30 acute beds, as they were known, in a very active surgical unit of the hospital. I could never get more than 3 or 4 hours of sleep at night. Naturally, when my head hit the pillow in those days, I slept like the dead. On one of those busy days, I reached my lunch late and had to eat it many hours after it was cooked. It was a plate of crayfish and some vegetables. I was too busy to feel any discomfort after eating the food. I went to bed in the early hours of the morning and all but died in bed. Not long into my sleep, I started to dream that I was in a boat on rough seas. The boat was being thrown about, up and down and side to side, motions dictated by the choppy sea. I started feeling more and more nauseated until I could no longer hold down what I had eaten, and only just managed to reach the sink in my room to throw up the food that had obviously gone bad. My brain could not have translated my need to get up and get rid of the contents of my stomach any other way.
So
It could
again, messages come in various forms from the subconscious mind.
It could only prepare me by exposing me to associated thoughts around nausea and vomiting. What better way than to take me through a sort of dry run experience of seasickness?
Great. So we can stop here today.